Most revered chief guest of the ceremony, Dr. Ketan Desai sir, Chief Patron, past President of World Medical Association, MCI and IMA, whose persona defies all boundaries and one of the most respected personality of our country. Very versatile, immediate past President IMA, Dr. Shahjahan Prasad Singh ji. Other dignitaries on the dais, my dear colleagues, guests, ladies and gentlemen. On behalf of Organizing Committee of National Conference of IMA, I welcome you all to the holy city of Prayagraj. Dear friends, in the functioning of Indian Medical Association, where transition is like a relay, where every team works for the welfare of profession, the Almighty has bestowed upon me to be the president of this august organization for 22-23. The baton has been handed over to me to serve you all to the best of my capacity and capability. It is my great pleasure and proud privilege to stand here before you with the blessings of our mentor, Dr. Ketan Desai sir, and support of almost 4 lakh members of the association. As IMA is the only umbrella organization recognized by the Indian government as representative of the doctor of the modern medicines, we share the responsibility of not only speaking for the welfare of its member, but also be a partner of the government in healthcare delivery. While the country is coming out of the dreaded COVID, IMA as the biggest health professional organization of the world is once again poised to mentor the healthcare system of the country. During COVID, we lost our 2,000 dear brothers in the service of nation and proved again that our pledge to serve mankind is fully intense and committal. At this juncture, I am both excited and bit apprehensive about IMA's role in the uplifting the morale of our professionals. My predecessors have kept the flag of IMA high, but there is still a daunting task to be accomplished. I accept it both as a challenge and as an opportunity, and look forward towards support from each and every doctor of the country. Our doctor bravely answered the call of duty, risking their lives and their family members, and managed to keep mortality to the minimum in spite of great challenges. A feat recognized by our Honorable Prime Minister and in fact by the entire world. Working in India, given its huge population and limited resource, is not easy. Per capita spending, though now improving under the present government, continues to be the lowest in the world. People forget that no other professional work 24/7 into 365 days with the same intensity, sincerity and passion of serving life as do the doctor of India. My mission for the year will be IMA for all for IMA. Friends, members number give you strength. As of now, about 35% of our graduates in the country are our member. And we can become a force to reckon with, making the remaining 65% also a part of IMA. Be it junior doctor, service doctor, a specialist in any branch, and friends working in corporates, villages and towns. Our voice will be loud and heard only when all speak the same language at the same time. We will be more assertive and strong when professionals in every nook and corner of the country contribute for the betterment of the doctors as well as community at large. Violence against healthcare professionals should be stopped immediately, and a strong central act against violence in any form, physical, mental, social or economical, on the doctor should be made a criminal act under IPC. And culprits should be punished under severe section as in other heinous crime. We request to the central government to kindly bring a central legislation for the protection of healthcare providers as early as possible. There is no other country in the world where doctors face violence in the course of their duty and the preparators go scot-free. Mushrooming of medical college needs quality control and must maintain the quality standard in the form of infrastructure, facilities, quality, education with adequate number of patients, but NMC is failing in carrying out adequate checks or on quality control. Unfortunately, this will lead to poor quality of outcome and ultimately affect the citizen of India. Giving the responsibility of healthcare of the citizen of India in the hands of poorly trained doctors will spend disaster for the health of the nation as a whole. Government should think over this. I feel the government should refrain from copy-paste culture of bringing Western world policies without understanding the negative impact on our healthcare delivery system. Exit tests will destroy the medical education system and invite more and more business houses to germinate coaching centers where medical students will only be preparing for next, ignoring the traditional practice training in the wards. The invaluable hands-on training which was previously imparted day and night by teachers and seniors who taught the highest value of ethics and professional conduct, it will be missing after the next. Students will hardly respect or listen to their teachers in medical college. As we all remember the saying, Bhavin Preet na hoye Gopala. On the one hand, the government is interested in only opening new medical college or converting the government hospital into medical college just to improve their indicator of increasing the doctor-patient ratio. But little thought has been given on the quality control of NMC by the NMC. Predictably, this will result in huge inflation of medical education fee, more than crores. But what will happen if after paying the crores of rupee fee by the sale of their houses, their land, or taking the bank loan, due to the poor standard of the education in the medical college, the student will be unable to clear the next? Who will be responsible? Who will be responsible for this bankruptcy of the parents and the medical students? The existing system of medical education has brought a lot of laurels to the country, and our doctors are considered the best in the world by the existing education system. Then why do we wish to destroy this by replacing it with a poorly thought out system of medical education? Government should seriously think over this aspect and should take IMA as permanent member, a stakeholder in their policy making committee, as this will help in providing the best workable advice to the government and ultimate benefit the patient and indirectly the political class. Here I would also like to bring to the notice of the government that making students file bonds involving huge amount running in lakhs of rupee and forcing them into rural service will make it economically difficult for the students of poor socioeconomic background to take up medicine as a career. Instead, vacancy in government hospitals should be filled by offering the regular jobs to the medical graduate rather than forcing them to work under the mandated bounds. The government should also immediately take cognizance on problem faced by Indian students studying in the foreign medical college, particularly in Ukraine, and should allow online education till the war is going on, as we done it during the COVID. It will help the student and their family here in India. Our government of the day are planning to introduce integrative medicine. You must be aware of this. And treatment protocol by 2030. In spite of warning by doctors of modern medicine, the government, through this populistic move, will do a disservice to the health of the public at large. The Ministry of Health has reiterated its resolve to implement integrative medicine. Integrative medicine is better understood by the term mixopathy, which we denote mixing of all system of medicine. Mixopathy has been adopted as a national policy through the national education policy itself. Khichdification of medical education seems to be the starting point. The purpose of integrating all system of medicine is unknown. 650 medical colleges in the country are turning out almost 1 lakh MBBS doctors every year. There is no case for pleading shortage of doctor. During independence, we had 40 crores people with a life expectancy of 27 years. Today we are 1.38 billion with a life expectancy of 70 years. IMA legitimately claims the credit of this achievement to be rightfully belonging to modern medicine. Today India is free of smallpox and polio because of the vaccination, which is an achievement of modern medicine. We have nearly eradicated measles, mumps and tetanus apart from containing HIV, tuberculosis and malaria. The maternal mortality ratio and the infant mortality rate have plummeted due to modern medical care. The dreaded COVID-19 pandemic was stopped on track by the vaccines of modern medicine. Modern medicine is evidence-based, double-blind control studies and applicability in unbiased setting elsewhere are the sine qua non of modern medicine. It is impossible to mix the different systems of medicine without catastrophic fallout on patient care and safety. The contradictions are self-evident. Today, Indian modern medicine doctors are adequately skilled to perform any sophisticated surgery or procedure that India is a much sought after destination for the medical tourism. Indian modern medicine doctors are the backbone of several health systems across the world, including UK, Gulf, US, and Australia. China is the only country which practices integrative medicine. China is certainly not our model in healthcare. Due to integration, Chinese traditional medicine has been disseminated and is no longer practiced in its pure form. Safeguarding the purity and legacy of Ayurveda will enrich our traditional medicine. And we are not against any pathy. Mixing of system will ring the death knell of Ayurveda. The loss of lives and suffering due to this unscientific mixing will be phenomenal. Healthcare in India will be set back by a century. The harm that will befall the nation due to mixing of the system will be profound. It is an anti-pupil policy, and unfortunately, this has not caught the imagination of the pupil. All MBBS doctors will be from integrative medicine by 2030. That means these doctors will practice and administer drug from all system of medicine simultaneously. There will not be doctors from modern medicine alone as we know now. IMA appeals to pupil and the government to understand the impact of this ill-advised decision. We expect the government to rethink their strategy. We are not against any government, but we always want to become advisor to the government. Government should not take us that we are anti-government or we are opposing their any policy, every policy. Our parley with the government should be business-like so that the government take our opinion seriously. Our demands like creation of Indian Medical Service Cadre, implementation of Right to Health Act, increase in the health spending to minimum 5% of GDP, Central Act against the violence at healthcare service, reinstallation of Dr. B.C. Rai Award, exclusion of health service from the CPA, exclusion of small nursing home and hospital up to the 50 beds from the Clinical Establishment Act, Interministerial Committee for any decision of the government on health issue and its recommendation to be adopted immediately. IMA appreciate the Ayushman Bharat scheme, PMJ, This scheme of the government for providing free healthcare to more than 50 crore population by an insurance scheme up to 5 lakh rupees. This can be a game changer for the healthcare delivery in the country. But our demand for rationalizing the cost of the treatment and regular revision of the provider fee has not been fulfilled by charges to make it sustainable by the private player. Unless until government rationalize all these rates, the Ayushman Bharat will not be successful in its real sense, in its real spirit. I would like to comment and improve and want a IMA working in the federal system. Dear friend, IMA is structured beautifully as the headquarter, state and the local branches model. And their integration is must for working towards the trust, prestige and glory of the profession. We have to strengthen by supporting our state and the local branches for a cohesive and effective working. Our motivation should come from the farthest doctor of the country, culminating in effective state working to promote harmonious working at the center. Our state branches should have a sustainable financial based system to be able to be strong enough to install confidence in local branches. The IMA calendar or the IMA days should be celebrated by all the branches in the same spirit and uniform quality. And this should be a major criteria of IMA awards in coming year, along with the membership growth. I will give the criteria 75% weightage while deciding the award next year. All IMA branches should focus on the numbers and participation in their all function and meeting as a major standard of success. There is no point organizing activity with little or no participation, and all the members should give their time to IMA activities. Otherwise, there is no point to of massive membership. Please understand, this is a very difficult and challenging time for the doctors. And only our unity and togetherness can help us to survive. Members and leaders at branch level, state level, at headquarter level should understand that unlike politicians, unlike the political parties, IMA election should not be treated as political elections. We are an association and should elect our office bearer by consensus or unanimity. I agree that elections are important for any democratic civilization and it brings answerability of the elected office bearer. But in association, election do bring bitterness amongst us and become a cause of division. So those who really want to serve and work in association should join hand and work without any lust or greed for the post. If we selflessly work, post will automatically come our ways. So we should have patience and work silently. We should stop infighting at all cost. We are already facing so many challenges from outside. So for the just sake of post, we should stop infighting. IMA functioning has to improve further to a next level. And we will try our best to bring a white paper on each health-related issues to help our members and people of India, as we did during the COVID, to sensitize the citizen of India as well as the medical community of India about the different protocol of COVID treatment, oxygen uses, vaccination. Regarding MSN and JDN, we should give a rethought. This is a huge task recognized by IMA recently. We need to have a plan to groom young professionals, especially from a small town, to be able to become leaders of tomorrow and take up the mantle. MSN and JDN have become forces of structure recently. We need to have training workshop to improve their skill in administration and management. They should be emboldened to take decisions. Ultimately, they will lead us. IMA Medical Student Network and Junior Doctor Network is our future and frontline warrior. All MSN and JDN units should take advantage of the huge professional experience and contact of the members of IMA. I wish to emphasize that IMA at all levels is there to help them in studies and career guidance. MSN JDN should maintain a high standard in their public life. That is underlined. Because they are the ambassador of IMA. They should focus in increasing the membership, as they can give a huge boost to the increasing membership. As we all know very well, strength comes from numbers. IMA has various academic, cultural, social service wings. They all are doing great job, but we need to have integration amongst them to avoid duplicating the efforts and increase their reach throughout the country. We should have a system whereby member can join any of these with maximum benefit. Some of these wings need to be more transparent and aggressive. All the wings of IMA should work to strengthen the IMA and extend the aims and objective of IMA. They should work under IMA at all levels, be it the branch level, state level, or headquarter level. The creation of Indian Medical Service, which is our one demand to the government, this has been our long-standing demand. In fact, this idea was moved by the government several years back. The need has become much more important now, as there is disparity of facilities, infrastructure, pay scale, and promotion of healthcare professionals in the country. We need technical administrators to give maximum impetus to the healthcare delivery system to the country. I am sure it will attract more and more quality, excellent, meritorious doctors to join like the other cadres are doing, and ultimately give a boost to our healthcare delivery system at all levels. IMA has various member welfare and family pension scheme in various parts of the country. They should be integrated and made available throughout the country through education and persuasion. We should continuously communicate about the different welfare scheme to all members through the state and the branch, and should make these schemes more efficient by joining more and more members in it. In the end, I assure you that I, as the captain of the team, will seek guidance and direction from all my seniors and involvement of each and every member during this year. Our team at headquarters, state and local branches will work coherently to make this year a memorable year. I once again seek your cooperation by continuing the excellent work in medical field and make sure to make healthcare affordable to every citizen and strengthening the hands of our government by participating in its all program, and make sure that no one denied treatment on economical ground, and take this an additional moral duty towards our nation without expecting anything in return. I always believe in working as a team, and my objective will be, as I mentioned, one for all for one. A cohesive and collective enhanced communicative approach to break all sectorial walls and bring all clinicians at one platform to help in building a healthy nation. Jai Hind, Jai Bharat, long live IMA.